Good morning, Dr. Tyler Hamel, Kingwood, chiropractor and nutritionist. Today, talking about the difference between sciatica and lumbar disc herniation. This is a question that was asked by a patient because they can present similar, and it's a little bit different in how you treat. Because one, a disc herniation, think of the disc in your low back, it's compressed and it's kind of coming out like a jelly donut when you squeeze both sides of a jelly donut. And that part of the jelly donut or the disc, it irritates the nerve. And wherever that nerve goes, you can have issues. So it could be pain, numbness, weakness, right? So depending on which nerve or what level of the lumbar spine or the low back it's happening, you might have pain and numbness down the front. It might be the side, it might be the back. And that's kind of the difference. Sciatica is always down the back. So think about, sciatic nerve running down both sides of each cheek. So sciatic pain, when you're having those problems, Steve says sciatic pain can make a grown man cry. Absolutely. Women, kids, whatever, it's pretty brutal, right? When sciatic pain is really bad, when you step down, say out of bed, or you're just trying to walk, extra pressure on that leg can cause extra irritation to an already irritated sciatic nerve, and that's really tough. So that's the difference. So as far as treating the problem, it's a little bit different. Everything with disc herniation, we want to try to stabilize the lumbar spine as much as possible. But in sciatica, we want to do that too, because the sciatic nerve is most likely being irritated because of some issues in the low back. But there's different stretches you can do for sciatica. Sciatica, of course, when you sit down, you can irritate it. So that is one of the really tough things. Whenever a new patient comes in, when we're explaining what can get you better faster, or things that might get in the way of you getting results for sciatica, say like sitting all the time, right? And lots of people today, they sit all the time. So how can you sit all the time and get sciatica better? It's pretty tough, but you can use pads and pillows and things like that and go with that. So Steve wants to know, what's the difference between acute and chronic? So basically, acute pain means something that just happened, right? So that could be a couple hours ago or a day or maybe 2 days. Chronic pain, we think more of problems that are lasting, at least a few days, weeks. And of course, you can say chronic pain. Somebody might have chronic pain for 10 years. More so acute pain might be more constant, more irritated. Maybe you had some kind of injury or it just happened. You were working out at the gym. You did something and boom, you feel it right then and there. Chronic pain is more of it's been there all the time, right? So maybe not as bad as acute pain, but it's still there. But really the problem or the reason that you're having the sciatica in the first place, it's going to be the same thing, whether it's acute or chronic. So whenever I look at that, we look at, that's what needs to be fixed, right? So, we talk about sciatica and lumbar disc pain and not... Patients really don't need to know about that much. They just want to know, well, how can you fix me and how can you get me back to doing what I want to do, right? Playing with my kids or lifting my kids up, working, golf, tennis, travel, even just working around the house, doing simple stuff. Sometimes they're not able to do all that simple stuff because of back pain or sciatica. But I just put this information out because it's pretty common. Sciatica, lumbar disc herniation or bulge, that's becoming more and more common. It does not mean that you need to get surgery. There's lots of things you can do. And if you're indeed having those kind of problems, you can certainly give us a call and we'll try to help you as best we can. We have a consultation. It's a free consultation. So if you're having neck pain, back pain, headaches, or sciatica, maybe it's been there for a week, maybe it's been there for 10 years and you really don't know what's causing it or what to do about it. You can come on in and the consultation's free. So I'll ask you questions. You tell me what's going on. I'll let you know if I can help you or not. If I can't help you, I'll refer you to somebody who can. But if I can help you, then we'll do an exam and we'll do a treatment. I'll kind of give you the idea of what we need to do to fix it. Fixing it, obviously important. How long is it going to take you to get out of pain? How long is it going to take to correct the process so it doesn't come back? Right? Of course, people want to get out of pain tomorrow, but wouldn't it be great if you could get out of pain for longer and longer and longer, right? To the point where it just didn't come back. And that's where people ideally want to get to. And that's what we do at the office. We set up a plan. Here's what we need to do to get you out of pain to this stage, and here's what we need to do to get you further along and fully corrected so it doesn't come back. So if this is you, give us a call, 281-360-8387. If you have any questions, put it in the chat box below. Any questions about our consultations? We accept insurance, we do cash plans, but the main thing when a new patient is coming in, before any of that, we want to know like if we're able to help you or not, right? So that doesn't quite matter until it comes time to doing the exam and the treatment. Again, very affordable cash plans. We do take insurance. Some insurance is great. We file it. Some insurance is not very good, high deductible. So the cash plan is a cheaper way to go. But we do whatever's best for the patient. So just keep that in mind. So Dr. Tyler Hamel, if you learned something about this video about sciatica and disc herniation, please give it a thumbs up and, share it with folks. I mean, I'm sure you know folks that have back pain and sciatica. Steve says, so true, preventative care is the best. Yeah, so for a lot of patients who are in pain, we just have to get them there first, like get them out of pain first. And then there's preventative things that you can do. And because we have just a ton of postural stress these days, I tell all patients, keep doing the postural exercises, even when you're better, you'll always want to do that because postural stress eventually catches up with you. And that could be sitting at a computer for 8 hours a day, or it can be usually sitting at a computer for 8 hours a day, and then you go to the gym after, or you go home and play with your kids, or you go home and do some work around the house. And that postural stress, it just makes it really tough on the low back and the sciatic nerve and that kind of stuff. So any questions, again, put it in the chat box below. Stay tuned for more videos. If you guys want to hear me talk about certain things or certain conditions, you can certainly put that in the chat too, and I'll try to get to those the best that I can. It's Friday morning, beautiful morning out there, so hopefully you guys get a chance to get outside today and enjoy some of that nice weather, and hopefully everybody has a great weekend, and we'll see you next time.